Okay, I think we will we'll make a start. It's very good to see those who can make this seminar. My name is Ann Borda, and I'd like to welcome you to this seminar series hosted by the Center of Digital Transformation of Health at the University of Melbourne. Firstly, I would like to acknowledge the Wurundjeri people of the Kulin Nation as the traditional owners of the land on which I'm speaking to you today, but I also acknowledge the traditional custodians of the lands on which each of you are living, learning, and working from. And as we share our knowledge today through this seminar, may we also pay our respects to elders past and present, as it is their experience and knowledge and continuing connection to land, water, and community that hold the key to the success of our future generations. Just before I introduce our speaker, I'd just like to say a bit about housekeeping. If you could stay on mute during the speaker presentation, but please feel free to post any questions in the chat. And we will proceed with a Q&A following the presentation. So now it is with great pleasure that I'll welcome our speaker today, Professor Hee Jeon. Hee is the Susan and Isaac Wachtel Professor of Healthy Aging at the Susan Wachtel School of Nursing and Midwifery. We're very pleased to have Hee today because she's a leading expert in participatory health practice, one of the foundations of digital health and connected health, which our center is also supporting. And among the initiatives that Hee is leading is a pragmatic RCT to evaluate models of care designed for community dwelling older adults with dementia and their family carers. And she's also recently established the StepUp for Dementia Research in partnership with a joint dementia research team from UCL, the University of Exeter, and the Citizen Science Node at the University of Sydney Charles Perkins Center, which Hee also leads. So without further ado, welcome Hee. It's a great honor to have you here today.
Thank you, Anne, for your kind introduction. Good morning, everyone. Can you hear me okay? Great, thank you. So let me just start sharing my screen. We did a practice run, so hopefully it works. Okay, now can you see my slide view, presentation view now? No.
Yes, that's very good, Hee. We can see that. Thank you.
That's interesting. It doesn't, so you can definitely see not the thumbnails.
No, we see a full image.
Cool. All right. Thanks, Anne. Thanks again, everyone. I feel quite privileged to have this opportunity to talk about patient and public involvement in research today. And Anne kindly introduced me as a leading expert. I have to say that I don't feel that I'm a leading expert in this, but this is an area of my interest for the last 20 odd years. And my desires to really enhance the way that we engage our patients, public citizens in our research so for the better benefit of mankind. So I also want to begin by acknowledging the traditional owners of the country on which we meet today. I'm from the University of Sydney, which is built on the land of the Gadigal people of the Eora Nation, and recognize their continuing connection to land, waters, and culture. And I pay my respect to their elders past, present, and emerging. So let me just provide an overview of my talk today. I've got about 35 minutes. I thought I should start, giving you some overview of different terminologies and concepts we consider when we, have conversation around involvement in research. And I also want to talk about, some of the examples, the projects that I have been involved and currently I'm leading that has, underlying kind of principles of public and patient involvement in research. Then I will, have a brief conversation around or discussion around some of the issues that we face when we conduct, patient and public involvement in research, which includes ethical principles and also some of the challenges we face in ensuring rigor of our research as part of the involvement process. I have these potential solutions and suggestions, and of course, this is just personal perspectives and lessons that I've learned over the years in doing this type of work in my research. So let me just start with some of the terminologies that we often hear about, and we have this, in Australia, we use the term consumers. We have patients, we have the public, we have community, citizens, people with lived experience. And these are the kind of terms that we hear, often when we make reference to non-scientists or non-researchers being part of research journey. And I tend to use, I'm going to use the patient and the public in this presentation throughout, but that could mean any one of those terminologies that you're familiar with. And we also, hear about involvement, engagement, and participation. And there are so many papers that actually try to discern the differences between, public participation or consumer participation, which is often seen as different to consumer engagement and involvement. And I guess, until recently or even now, we use the participation in a way that we describe when we describe a research subject, and we don't use the subject, the term anymore, but when we describe research participants, we refer to those people who complete surveys or people who actually, participate in interviews or participate in trials. Whereas when we talk about engagement, we talk about, often knowledge transfer, or we, providing some form of education to the public. We engage them in the process of, disseminating information. When we talk about involvement, then we talk about, the public and patients or the families or health consumers being part of more, active process. They could be part of data collection, or they could be part of consultations and so on. I'll go a bit more detail later on. But, these are the terms that we use. And there are also research methodologies that we use, community-based participatory research. That's a kind of a genre of research that we often describe. And we have, public participation in scientific research, citizen science, and community science. The list just goes on. But whenever we talk about this participatory research, then there are some underlying principles that we are aware of and we try to adhere to. It is about the person, the end users. They become the center of our attention. And this is inevitably, addressing the power imbalance that often we have, or inequity between the scientists and the non-scientists or researchers, or who are going to use, whatever evidence that we generate in the end. So when we talk about participatory research, we really focus on empowering the community, empowering the public. And also in doing that, we are actually, we are respecting their, autonomy. We talk about being advocate of those people. And this is about egalitarian principles. And there is, it shouldn't, researchers and the public, we should be in, on equal footing. And we also need to think about diversity and inclusiveness. And and as a researcher, I don't feel that I am doing a good job of this, but I feel this is something we need to keep working on to ensure that diversity and inclusiveness is part of our, research, or, important principles that we need to follow. And democratization is, again, is similar to, the egalitarian. These are the concepts that we constantly, think about when we conduct participatory research, whatever we term our methodologies. So, the next slide that I'm showing, just shows, how many, different terminologies have been used when people describe this PPI or citizen science, or in recent times, we talk about implementation research that inevitably, requires engaging end users of whatever evidence we generate. Some people divide this type of research along the line of, volunteer monitoring, community science, participatory action research, collective participation. And another way of describing this, it could be, engagement and participation and involvement. And they, there are overlapping, this Venn diagram as showing, there is in the middle that shows community-based participatory research, extreme citizen science, which is very much about, co-creation and co-production. But you can see that there are different ways of engaging or involving the public in our research. So, the one that I also find quite useful is that, our colleague, Sam Robotham, has written a very, nice summary of, defining citizen science and the processes. And it really shows that there are different layers of involving the public or, patients in our research journey. And it also, kind of tells us that it's not just, one, level of participation that, allows us to think that is actually, citizen science or participatory research. Depending on the type of research that we do, or depending on the type of research question that we want to answer, we want an answer for, that we use different ways of involving the public. So, so these are the different, ways of describing public, the patient and public involvement in research. And I just thought I should just make this upfront overview of different ways of looking at PPI in research. So, I also want to kind of draw your attention to the NHMRC statement. This is one of our major research funding bodies in Australia, and it really emphasizes that importance of involving, they call consumers, and they define how, who they mean by consumers, and them being part of our, research journey. And they kind of emphasize that, consumer involvement as a, consumer being part of the decision making. So researchers are not just, doing research for the benefit of, answering research questions that they set out to do, but the consumer being part of the decision making. So you work with the consumers, by consumers, rather than research to consumers about them. So I think these are the kind of things that we are acutely aware of when we design our research, and I also want to acknowledge that the participation, public participation, isn't just limited to research. They participate in service design, health service design, but also policy development. So there are different spectrums, again, that we need to think about when we, use the term PPI in research. And sometimes when we do research, that the boundaries between research and practice can be sometimes unclear when we do implementation research. So I thought it would be really helpful for us to actually think about those different, angles that we kind of think about when we do research, because those days of researchers just doing their research, publish their paper, and then walk away, that's no longer part of our practice. We constantly have to think about knowledge transfer, knowledge translation, implementation of research. So it's no longer, our findings, for our research question is no longer, they're no longer the end product. So I thought I'd just, go through those terminologies, and this kind of, I sometimes call it movement, PPI, because 25 years ago when I first did my research, more than 25 years ago, but it wasn't even in our radar when we talk about public involvement in research, although we valued the volunteers or public's contribution to research great deal, but the PPI wasn't actually really strongly emerged in any of the policy documents, but nowadays you see them everywhere. And it's not just Australia, it's a global, kind of a trend. And in the UK, that they have this, organization involved. I think they've now changed to something else, but they have this kind of, a body that sets the agenda for public involvement research, and also they provided resources for the public to learn about what it means to be part of research, and then also helping researchers understand how best they can involve the public in their research. So this is something that that globally that is recognized as an important part of research journey. So I thought I should just, give you a few examples of what, how my work has actually included this type of research. And so that starts with, Cognizance project. So this is co-designing dementia diagnosis and post-diagnostic care. And it aims to improve the dementia diagnostic process, especially how, the specialists, or diagnostician communicates diagnosis of dementia with people with dementia and their families. And also we want to improve post-diagnostic support. And the way that we want to do is that we created some form of, digital platform or web interface where people can, come to the website and they understand, better about dementia and what it means to have dementia, but they, how they can live well with dementia. So we use the co-design approach, working with, consumers, the people living in dementia, care partners, and health and social care practitioners, and other voluntary sectors. So what we really want to do is to use this digital form of digital platform to engage the public. But to do that, we want to design the actual platform that is going to work for those who are going to use the platform. So, we created various, co-design groups. And so this is a international collaboration involving 5 countries. And we have, individual country-based working group. We call them local working groups. And then we then also have international design team. So these are the people actually provide active advice and direction around the development of key campaign messages and images, and the tone of the messages. For example, what we really hear from participants from our focus groups earlier was that we really want to emphasize there is life after the diagnosis of dementia. We want to make sure that the people who have been given diagnosis and their family members have a clear understanding of what they can do, rather than having diagnosis as some form of this is a finite kind of the end of life, you have to actually go and get your affairs in order. So there is a lot more that people can do and to be supported. So we want to make the tone of the actual website more positive, and also that aligns with what people really want. So these are the things that we, the co-design is an important part of the Cognizance program. And the next project is, we did a few years ago, working with Arthritis Australia. And this was, designed to address the issue of how we actually, kind of embed evidence-based practice, or how we also support people with osteoarthritis to use the most up-to-date evidence to actually self-manage. And that's a really important part of, the program that we designed. So we want to make sure that the whole process is, again, informed by, people who are running Arthritis Australia, but also the very people who have or live with osteoarthritis. And we want to make sure that the whole website is actually, designed to make sure that, the people have a place to go, but also they can actually use that place to plan for their own self-management, so that the self-management strategies can be based on their personal preferences, clinical characteristics, and also the benefits and harms associated with the, alternative options. So this is about giving the, patients living with arthritis some form of control that they can have. So they could go to their website, and then they can actually start building their own report that they can use. And then, it has information that is automatically generated depending on their, the assessment they go through. And in the end, they can print out this information and take it to their clinician, so that, the clinician and, and the patient have conversations around the different aspects of treatment options. So, so this was kind of, the My Joint Pain is still continuing, but, the reason I'm mentioning this particular project is because we really wanted to combine this, co-design process with research. So we conducted in-depth, interviews with those people who participate in the program. And also we did a survey, 12 months and 20 months, 4 months follow-up to understand what their experiences were, so that we could actually enhance the actual, the digital interface that we, plan to deliver. And, it was really helpful to have that, qualitative interviews with those people who have used the, the digital interface, because it allowed us to understand what it is they valued most, and what participants said most, prominently was that, using this type of interface, gave them a control of their lives. And I guess, the fact that they now are more knowledgeable about their health condition, and also there is a tangible report they can print out, and they could actually go and talk to their, healthcare practitioners about, what they think, what they can do. And then sometimes they negotiate how they manage their conditions. So I thought there was a, a useful example about how we actually combined, co-design the consumer perspectives or the patient perspectives, working with Arthritis Australia, but also using our qualitative interviews. The next one is the latest work that I'm, currently working on. It's called the StepUp for Dementia Research. So it's designed to address a very, a serious or significant challenge that we as, dementia researchers face in recruiting participants. it's often due to with the stigma, but also, lack of public understanding about dementia research. And also, it is quite challenging for us to actually identify, our target, population for our research. So this is modeled by UK's Joint Dementia Research, and we, built this digital platform to be a one-stop shop for dementia research recruitment in Australia. So it's a free opt-in, it's almost like online dating that connects individuals, people with or without dementia, with researchers conducting studies into dementia, prevention, diagnosis, treatment, care, and cure. So we support all types of research, and anyone, 18 and over, with or without dementia can sign up. And then the sign-up process then, allows people to have their information stored in our database. And then what we do is that, we then ask researchers to register their studies, and the volunteers sign up and answer some very brief questions about their own, their own kind of, information, and then researchers then provide information about their studies. So eligibility criteria then can be matched to the volunteers data that we collect. So when the study is registered, then we then turn on our matching algorithm, and then when the matching happens, then we can start, talking, those volunteers then get a message saying you've been matched to a study, and researchers get a message saying that you have volunteers matched to your research. So this process then allow, researchers to directly contact volunteers, so that, we are kind of removing middlemen when it comes to research. So this is an important part of, infrastructure that we have built, funded by the Australian government. And this is the first time that we are actually, able to support the public. They know, once they get to find out about StepUp, they know that they can register for their interest, and they then can be, matched to any type of research, and they have power to say whether they are interested in being part of the study or not. So it's a quite an innovative approach that we have introduced, and we now have over 1,000 volunteers in our database, and we've supported about 34 studies today. So it's been just over 1 year since we started this, offering the service. So one of the things that we really want to do is that we want to add functionality to recruit people who are interested in involvement. So when we did our evaluation, between 65 and 80% of people said that they want to be, involved in research, not just as a participant, but they could be part of, research design, data collection, steering committee, and so on. So we do know the public is very much interested in being involved in research. So this is an important part of the journey that we have gone through to really understand what it is that we need to address when it comes to filling the gap of supporting the public to be able to say that, I'm interested in research, but there is no place I can go to. Now I know where to go to, and then they have a say in how they participate in research. So I've given you 3 examples, and I'm really sorry that I've kind of, realized that I had to run really fast to talk about the rest of the ethical issues. And I can see that I've got just 10 minutes to talk. What I've learned so far is that, as I showed at the very early phase of my talk, that there are different ways of being involved in research. And depending on research question, not every research question is going to require co-creation or co-production. And therefore, it is really hard to say that, there is one, kind of framework that is going to help everyone to be very, effective or authentic in PPI. There are, a lot of literature that gives you very good information about, PPI and how you do it. But I feel that, it is important that there isn't actually just one size fits all. PPI is, in terms of using digital platform, it's not static. Technology keeps evolving, and people actually change their perspectives of how they want to be part of the process. And also the way they see the actual program or intervention also changes. So I think it's important that we don't just, involve the public at the beginning and believe that's the end of it. We need to continuing engagement of these people who are going to be end users of the program, and then continuously, improve the system. And also, this is a very big question about, the PPI, how we actually reconcile between engaging them and then maintaining research integrity in our research. And because sometimes, we follow a very traditional model of research, rigor, validity, reliability. And, if you're doing a trial, then there is a little room to be influenced by other people in the process. So, there are many papers that actually talk about different ways of, doing it. And I'm happy to, discuss this after this talk. But I think, no matter what we do, that we have to actually constantly reevaluate the way that we involve the public in research, and at the same time maintaining our research integrity. Unfortunately, digital platforms cost a lot of money in building, also maintaining. They should be part of the process, and so therefore sustainability has to be, part of the plan from the very outset. And so this is something we constantly discuss in our service, StepUp development as well. So now, one of the articles that I just thought I should, highlight here is that when we talk about, co-design and co-creation, so this is an element of, PPI, not the whole picture. We often talk about ethical issues, and what researchers often face is that, do we actually have to get ethics approval for this involvement aspect of our work? And sometimes ethics committees require that, approval, but then the issue is that you want to actually involve the public before you finalize your research questions or research the methods. So it's a catch-22 almost. So I think what we are trying to do, is that we as researchers passionate about PPA, we need to also inform and educate ethics committees. I can still remember more than 25 years ago when we were doing qualitative research, we almost had to fight with research ethics committees because they didn't fully understand about not having, concrete sample size. Nowadays that's no longer an issue because now people understand what qualitative research is about. So I think it will take time, but it's really important that we educate other people involved in decision making about the value, the diversity, and also, power sharing, the importance of that as part of our research outcome generations. So, so I think this is a quite useful paper that I, would like us, like to actually introduce. Now, just along the line of, PPI, I thought I'd just bring this citizen science that we talk about. When citizen science is a rather new concept to me. It's only a few years that I, have been working on. And it really helped us, when I think about citizen science, that where, we thought the PPI is the only way of doing it. And then I'm learning now huge amount of, new knowledge around citizen science. And I, encourage you to actually go to this website, American Philosophical Society's the latest symposium, The Promises and Pitfalls of Citizen Science, and really highlights, the breadth of, the fields in citizen science, and how, PPI is strongly aligned with those principles that we talk about. If you look at these, 10 commandments of citizen science, you actively involve citizens in scientific endeavor. You have to have a richer, a mutual benefits. And also you have to make sure that, legal ethical issues are covered. And at the end of the day, we need to actually make sure that there is a scientific endeavor. Otherwise, why would we call it citizen science? We're not, we want to generate new evidence, or we want to actually make sure there is a new insights generated. So these are the things that, that I've been, doing for some time. And I think, I just want to conclude by saying that the participatory science is evolving. When I look at other disciplines, like there is a field of study looking at, the nature of, how we actually conduct research, how we actually, engage our politics and our society in our research, how they actually influence our outcomes. And there is a broader question that we often forget to ask. So I feel that, we really need to open our mind about the fact participatory science is really broad and it's continuously evolving, and it really encourages the interdisciplinary collaboration. And also we need to, continue our effort to enhance methodological rigor, diversity and inclusiveness in our endeavor to generate new insights and new evidence. And what we also need to think about is that we need a system and policy level recognition. Nowadays a lot of grant funding guidelines tell you that we really need to involve the healthcare consumers or patients or the public in our research. So there is definitely a movement and emphasis on this, but at the same time we still grappling with so many different issues. How do we actually ethically engage them or involve them in our research? What guidelines do we need to follow? What kind of resources are available? People don't necessarily know how to be part of research as a lay person. How do we support them? And how do we make sure that we don't exploit other people's good intention? And there needs more infrastructure to drive and maintain PPI, and that's what StepUp is trying to do. And also we need to make sure that their IP, intellectual property, is also protected and recognized. So there is a lot more work to be done in this area, but I feel that there is a broader community working on citizen science, participatory research, that really have these constant debates and conversations and dialogues around how we actually enhance and move forward this movement. And I'm going to just, show this final slide about the ladder of citizens participation, 1969. And it says that the idea of citizen participation is a little like eating spinach. No one is against it in principle because it's good for you. But the applaud is reduced to polite hand claps. However, when this principle is advocated by the have-nots. So this really emphasized the actual power imbalance. And this is an interesting kind of a diagram. I participate, you participate, he participates, we participate, and you participate, they profit. And it's I thought this is a very interesting way of kind of summing up of often that when we involve the public, that we don't necessarily think about their rights, and also we can be inadvertently, be in a position of, exploitation if we are not careful in how we're actually involving people in research or scientific endeavor. And so I think, I think this is where I should stop. And there are references. If anyone is interested in, I'm happy to share my slides. So I thank you for your attention. Thank you.
Oh, thank you very much, Yoon-hee. That was a tremendous presentation. I think we've learned quite a lot about this very complex area, participatory health, and you've helped us navigate through quite a bit of the foundations of this, and through your experience and projects. So we're now opening up to questions, and we have a set of 3 questions from Zarina Tompkins, which I'll just break down to the first question. So when selecting consumers for involvement, how do you account for non-English speaking backgrounds, and that the group represents as broad a group of affected people as possible?
Yeah, thank you for that question. This is the part that I as an individual researcher, have not done a great deal of good job. But whenever we try to form a group of co-design groups, for example, or some form of reference group or guidance group, we endeavor to find someone with different, who can provide a different cultural perspectives. I mean, I guess it become, if you look at the I think there was a report about diversity, how you define culture. Culture is a very fluid term, and it's not limited to someone's ethnicity. And it becomes really challenging for us to cover all different types of cultures, right? And so I guess it depends on the type of research question you're asking and the kind of input you want to draw from. So, a typical way of, inviting people to be part of a co-design group is that, often we use our networks, but I think we need to go broader than that because, as you can see nowadays, all these grant bodies expect us to involve the public as part of, or the consumers as part of our, research process. And often we then reach out to particular, advocacy groups to see if there is anyone who can support your work. It becomes really hard, but I think, that's why I want to go back to the earlier example I gave you about the osteoarthritis hub. I don't think the co-design group alone is going to address all the issues of diversity. So I strongly recommend that we have another, kind of research method. It could be focus groups, it could be interviews. So then the findings from those, perspectives gained from focus groups and interviews could be then, discussed as part of the co-design process, rather than we rely solely on the co-design group, because it becomes really difficult to actually, go through the whole process of co-design. Even if you invite one, person from a different culture, that person is not necessarily representing that culture entirely. So you do have to actually mix the co-design kind of group with the other research methods, so that you have a process to reflect and, have an open conversation with the co-design group. So I don't feel that co-design group is going to be the, only source of the overall, evidence generation. They provide expert input. They can, tell us how they think, how they, whatever product we are thinking about could be suitable or not. But nevertheless, That voice needs to be part of the journey, but not the sole, angle of the findings. I'm not sure whether I'm answering the question.
I was sort of thinking more in terms of spectrum of dementia. So for example, we know that it starts in a gradual way and at some point it accelerates in terms of impact that it has on people's daily activities. So I guess, there is this perception of what dementia might be as the process occurs by the person who's experiencing it.
Yeah.
And I guess the other issue is also the fact of the involvement of mental health services towards the end stages of dementia, where in many cases actually treated more like a mental health illness rather than biological deterioration that occurs through it. And so, if you're looking at that representation from the spectrum of the disease progression, both from anatomy and physiology point of view, and also then from the participant experience, it seems almost really hard to capture all that spectrum.
No, yes, you're absolutely right. So that's why I don't think, I remember a particular consumer saying that I'm here to provide my perspective, not just my perspective. I provide, ways for researchers to think about, but my view is not a representative view of all these people who, and this person didn't have dementia, had other chronic conditions. But I understand that, with dementia, it has additional layer. Because once the person loses their cognitive capacity, they are no longer able to be part of the very conversation, right? So then sometimes we work with their carers, who can actually provide that the view as a carer. It's not perfect, but there are ways that we can engage, other care partners or people who are providing that, daily support.
Thank you, Uni and Zarina. And Zarina had another two questions, which maybe we'll see if we can just, you've answered a little bit of it, Uni. So the second one was about developing the intervention and how we disseminate that to the public.
Sorry, I didn't catch the earlier.
So it's another part of similarly expressed, but looking at now the dissemination. So how do we disseminate to the public?
About any type of research that we do. Who can?
So, for example, if once you develop this platform and you want people to use it, how do you ensure that it trickles into communities where that it exists?
That's really important, and I completely forgot to mention. So our StepUp for Dementia Research, but also with the Cognizance, Forward with Dementia, there is a major campaigning that goes with the digital platform. So we can't expect the public to know about us just by creating the website, right? So often these digital platforms, once you've, so there are so many layers until you have finalized and then improved, right? So we use media, we use not just social media, we use various, champion organizations who have similar, ambitions or visions around how to improve, dementia care or, dementia research. So we need, kind of an extra layer of work that if we want our digital platform to work.
Yeah. So thank you. Yeah. Thank you, Uni. I'm just conscious of time, so I'm just going to try and get as many questions as I can to you, but that was well answered. Thank you. And thank you, Zarina. Come back to your third one, because I'd like to maybe ask Shah Khan to, you had a question in the chat. Would you like to ask your question, Shah?
So Shah.
I think it looks like his screen got frozen there.
So Cecily has, while we're waiting for Shah, I can see someone.
Shah, are you available to ask your question? What I might do is ask him to type it in the chat if he's having some difficulty. So we have another question from Cecily. about the StepUp platform, similar to Australia's health panel. Do you want to say something, Cecily, about your question?
I hadn't planned to ask anything more than what's there. It's just that I was aware of the CHF platform, and I wondered what overlap there might be, or what other possibilities there might be.
So can someone explain? I mean, I did some work with Health Consumers New South Wales, but not the Consumers Health Forum.
Hello? Sorry.
Yeah. Oh,
I'm
Sha.
back.
All right. So Cecily, this is really interesting. I don't know about it. So I'm very happy to learn more about it. Yeah.
Okay, that's
perhaps I'll put a link for it in the chat window, and that'll enable a bit more exploration of it. No need for an immediate answer. Thank you.
Thank you. Now,
Sure.
Shah has a question.
If you ordered the food, then that doesn't matter.
Hello.
Hi,
Yeah.
Char.
Hi. Can I ask my question? So I mean, a very good presentation. So my question is in regards to the application in terms of its usability. So similar so I think dissemination of this sort of a project to the primary health network is really important in terms of its reusability and translation of its use in the public sector. So
Yeah.
similar to this sort of a project, there has been a project in Tasmania done previously. It didn't use digital health tools because it was developed back in 2016 and 15. And as a public health association representative, I was part of that project. It's called Epilepsy Connect. So what it did, it used to connect parents whose children have recently experienced epilepsy to parents who have already have it. So they share their experiences, and in terms of that, it was one of the of a great model in terms of translating research into practice. So
Really
through that, researchers gained insight to develop strategies to for early diagnosis and early management of epilepsy. So similar sort of thing could be actually implemented in this tool, because digital platform actually connects people more faster and more stronger. So in terms of that, I think public engagement is one of the important thing, but would be very interesting rather than the developing side of it towards engagement side of it, because more than 50% of applications, when they are developed, they are not really used. So how would you actually work towards promotion, health promotion aspect? Yeah.
And I think that's a similar, question to the earlier one. So it's, we do have to actually communication strategies built in. That was part of what we did in StepUp. With the Forward with Dementia Cognizance project also has this, communication strategy. So, whenever we develop some form of web interface or digital platform, we have to build a, reasonably good protocol about how we communicate this, so building champion organizations, and we have ambassadors like Ita Batros or Graham Samuel, Kay Strapper, so we do have to actually think about how other people know about our, the very existence of it, right? And then we have to also make sure that they come to our website and then make sure they're part of it, because people may come to the website, but then they might find that this is not what they were looking for, or if it's too difficult to be part of the interface, then it kind of, we lose them, right? So that's again going back to when we designed the whole digital platform. That's where these, the end users, people living in dementia, families, and other people who have their lived experience come here, and also people who, are concerned about having memory issues, right? So there are all, kind of different people who are coming on board and giving us, feedback about how this can work well or not. So that process takes, several months to finalize. And then once it's built, then we still have to continue working with
Yes.
people. So we have a group called the Public Involvement Panel for our StepUp. We meet with them every 2 months, and they become champions, but they also provide ongoing advice as to, you know, how we can do better, what kind of things that we need to, you know, to consider. So that's why I suggested in my talk that, you know, we really have to plan for ongoing, you know, enhancement. It's not gonna be, you know, one finite product, and then,
Yes.
so that's why yeah, it is part of the process that people don't necessarily think about if they haven't done this work before.
That's right. And one of the key important areas are also to focus on, I would suggest, would be rural and remote regions in Australia, and also partnering with health centers, for example, residential aged care facilities, disability services,
Yeah.
and homelessness organizations, also independent housings.
Yes.
So partnering with them, I think it would also help to engage with not only the people who are experiencing, but also with their carers, their families.
Yes.
So it's
Yeah.
more of a very holistic model that actually could work and
Yes.
transform
And
people experience.
that's right. So when we did our survey of StepUp, you know, we do annual survey, and we asked people whether StepUp helped them to actually, you know, understand better about dementia and dementia research. Of course, they say yes. You know, the majority of them say yes. But also they, you know, were satisfied with the StepUp, you know, making the process easier. And what we also do is, as part of champion, you know, organization work, that we engage aged care providers, disability sectors, as you just mentioned, advocacy groups. So we keep, you know, kind of growing our champion organizations, because if we don't have actually volunteers to participate in research, there won't be any research. And I recently heard about, you know, due to pandemic, people are completely overloaded. You know, nowadays also everything you get asked for the survey, how satisfied are you? Or, you know, so people are less and less, you know, interested in being part of any research. So we actually need to do a better job of how we actually make sure that the public, our society, becomes part of our research solution, rather than us as researchers telling them what to do or what they can or can't do. Because we actually have to, you know, solve the problems together, and they have to be interested, and they have to be part of the ownership. And that's why this participatory research is becoming more and more, you know, important, because I think people are nowadays more, you know, aware of, you know, their rights. They also want to be part, you know, at the end of the day, most of us use taxpayers' money to do research. It's their, so it has to be their solution, not just our interest.
That's a very powerful thought to end, Uni. Thank you very much for a very passionate presentation, a very great learning journey for all of us. And thank you to those who participated. And just to alert you to our next seminar on the 13th of May by Professor Douglas Boyle on the all common data models for data-driven research. Thank you everyone for your time. And I hope to see you in the next seminar. Thank you, Yoon-hee, once again. A very big virtual applause for a fantastic presentation. Thank you.
Thanks, Anne. Thank you, everyone.
Thank you. Bye.
Bye.